Hi. Let's talk about one of the biggest differences between living in the US and Canada, the healthcare systems. It's a hot topic, especially for newcomers or those planning to make the move. In the US, healthcare is a mix of private insurance policies and government programs like Medicaid and Medicare. Many workers get insurance that is subsidized from their employer, but others have to buy private insurance policies, and healthcare premiums and deductibles can vary widely. In Canada, healthcare is run by each province. You pay higher taxes than in the US, but many services are covered with no out-of-pocket costs. Everyone takes part in the same system regardless of their age or employment status. For high-income earners and small families, the taxes paid for healthcare in Canada can seem pricey compared to the US, but for lower-income earners or large families, it's much more comparable. If you're new to Canada, there's usually a 3-month waiting period before provincial coverage kicks in. But here's the hack: arrive near the end of the month. That first month counts towards your wait time. While most core services are covered, private insurance is also available for more comprehensive coverage, and out-of-pocket costs in Canada are often much lower than in the United States. The biggest complaint about Canadian healthcare is often about wait times. It is true that wait times for some procedures can reportedly be up to a couple years. Longer wait times generally apply to non-emergency and elective services. This is why the private health insurance industry in Canada is growing. Finding a good primary care physician can also be a challenge in Canada. There are urgent care services, and this is something you should research before moving if you have specific healthcare needs. If you are heading to the US and you're retired, make sure you either qualify for Medicare or understand your expected healthcare costs before moving. The Affordable Care Act is guaranteed issue, so you will be able to get coverage, but it may be expensive. If you're working, check with your employer first. If you'll be purchasing a private policy, get in touch with a good insurance broker to make sure you get the coverage that is right for you. So whether you're heading north or south, understanding your healthcare options can help you ensure a successful move across the 49th parallel. You can get in touch with us using the contact information in the comments if you would like to discuss further. From the desert to the tundra, we are your cross-border retirement experts.